girl's nails had fully recovered, and I think that may suggest the growth factor involvement in recovery of the nail matrix combined with the anti-inflammatory effect of wheatgrass is the reason for that. But I've seen this girl had given up. She was just finished with life. She was bent, her head was down and her arms, hands underneath her arms, and she was protecting, didn't want anyone to see her nails. She was terribly embarrassed by it all. And she came in to see me to go back to Japan, and she came to thank me for giving her life back. And I said, it wasn't me, it was the grass. We saw some equine wounds earlier in the Ayurvedic presentation. I found that very, very interesting because we get a similar effect, but we haven't done 350, we've only got this one. But this wound was maggot-infested, worms or all sorts of things growing in it, and the horse was bitten by a wild dog. And you can see in 2 weeks the wound is completely debrided by the wheatgrass. That's all they put on it. And in 8 weeks the wound is covered and the hair's grown back over it. And this isn't a normal healing thing that you see healing in horses. And I don't think I could be criticised for speculating the growth factor activation has taken place and aided this recovery. It's only a guess, but I think I'm sort of on the way, I've only been with it for 18 years. This patient needed skin grafting when a dog bit a large chunk of flesh out of his lower leg. He'd been visiting his local hospital for 6 weeks in an attempt to get the graft to heal. This was so time-consuming, his business was suffering. So if you see this dusky, dark, ischemic look, this purple look, and this sunken areas here, there's no turgidity in this wound, and there's a very ragged edge around the graft itself. And a couple of days later, the wound is fully turgid. You've got nice, fresh-looking granulation tissue here, and if you look at the edge, how that is seamless now. There's a beautiful healing process going on there. In 3 weeks, we've completely healed the thing. He didn't have to go back to the hospital. He changed his own dressings, no antibiotics, nothing. He did the whole thing himself. And here you've got a classic example of wheatgrass being able to work both as a hemostatic and a hemolytic agent. This footballer was kicked in the head by an unfriendly opponent. I was there at the time. And the hematoma you see on the left was actually photographed 1 hour after the wheatgrass was applied. So when he came off the field, his head was up like a football. It was blue, it was tense, and he was in a fair bit of pain. And I put I had wheatgrass cream there. I put a bit of cream on his forehead, and he said, "Aren't you going to use ice, Doc?" I said, "No." I said, "That'll be gone in the morning." Well, I won't tell you what he said, but he went back on the field, and when I saw him an hour later, that's what he was like. It had gone soft in an hour. And the following morning, the trainer rang me from the ground, and he said, because they were down there training, and he said, "Look," he said, "just thought I'd let you know that everyone down here is talking about that grass, that cream." He said, "The swelling's gone." And I said, "Well, I told him it would," but he didn't believe me. But anyway, this is the sort of thing that I've been seeing a lot of. I've been a football doctor, and I've done all sorts of sports injuries for a long, long time, and we don't use ice anymore. In fact, ice is contraindicated because the Cleveland Clinic, a sports clinic, has done a study showing that when you pull a muscle, injure a muscle, there's a massive outpouring of IGF into the tissue, and which is necessarily to stimulate the recovery process. And if you put ice on it, you slow the recovery. So we put wheatgrass on it. It gets rid of the blood, which is the blood's in the wrong place. It's in the tissue, where it shouldn't be. It absorbs that clot, even a deep tissue. You put it on the skin over the surface of the injury, and I've done this thousands of times. And it absorbs that clot, and they get running again, usually the next day for a pulled muscle. Or I'm not talking about a massive rupture of a hamstring. I'm talking about the standard sort of injuries that you see in athletic sports. So so the resolution in that last slide is a number of implications in the surgery and injury field, surgical and injury field, as I've mentioned. For instance, I've performed numerous procedures using wheatgrass as a hemostatic and anti-inflammatory agent. I simply spray the extract on the open wound and wait a few minutes. Usually by the time I've gloved up, capillary bleeding has stopped and I'm able to operate on a bloodless field without using adrenaline, which I think is a big plus. What's more, when the dressing is removed the following day, it doesn't stick to the wound, little or no clot is visible, and the wound itself is not inflamed and scarring is reduced. Hard to believe, it's very true. I do a lot of procedures, or I used to, and I used the grass. I never had an infected wound in 16 years of medical practice, and I don't reckon that's a bad record. Another important feature of wheatgrass is that when it's applied to the skin, as I mentioned, overlying a deep tissue injury such as a pulled muscle, the hemostatic effect penetrates into the area. I think it's a neurohumoral thing. I think that whatever the bioactives are in wheatgrass, they touch a surface nerve, and seems to be this cascade of influence goes into the tissue. And I've had patients with massive corked muscles and things like that, and swelling's going down overnight, just like the patient with the bruise on his head. So it works in deep tissues and superficial tissues. To partly prove my point, you're about to see what is quite likely your first glimpse of a natural hemostatic agent at work. Sorry. This is the one. No, it's not. Or should be. Can you do something about that? You're about to see a world first. I was about to show you a world first. It was what I brought it all the way up to Chennai with me, and I was going to impress you with a marvellous video of a tattooist about to prove my last point. And what happens, he's tattooed his work for about 15 minutes on the skin, and then it starts to bleed. And you can actually see the capillary bleeding. It's oozing up to the surface. He gets the spray. He sprays it on 3 or 4 times over the area. Then he gets a cloth, he wipes it off, and there's no blood. And he leaves it, and he leaves it, and he goes on for another 10 or 15 minutes, working on a bloodless field, which I think every plastic surgeon would love to have. And the blood doesn't come back again. So it would have illustrated nicely what I've been just trying to tell you, but that'll have to have its world premiership in world premiere in Australia now. I'm sorry about that. Now, we're talking about neuropathic ulcers. This is a summary of the results of a leprosy ulcer study that we conducted in Madhya Pradesh in 2008-2009. And Dr. Lakshmarian Vadarajan was sitting in the audience there, and he did all the groundwork for us, took all the photographs, followed up all the patients and things, and sent me the information in Australia. And we've written an article on that, which we hope will be published shortly. 19 ulcers ranging in duration from 1 to 13 years were sprayed on alternate days with wheatgrass extract. Just a bottle of that stuff. That's all. He gave them a bottle and they did it themselves. And they 40% of them healed completely. And in another 40%, there was greater than 50% wound coverage in 1 year. And it's interesting to note that all the patients remained ambulant throughout the study. They didn't have proper shoes or anything like that, or cast or anything. And in 2 patients, there was recovery of pain sensation, which rings another bell, or a suggestion perhaps that there's some growth factor activity going on. And there's a similar healing pattern as in both leprous and diabetic foot ulcers when you use the extract. In the first few days, the surrounding skin softens and this facilitates debridement. Revascularization usually occurs in about a week when the ulcer floor becomes revitalized. And I have no direct proof, but I believe this is due to recovery of the microcirculation. I don't know what else could cause it, because it's the microcirculation that ain't there that causes the floor of the ulcer to go grey. Wheatgrass revealed that many leprous ulcers have quite markedly undermined edges, and which makes the ulcer appear deceptively small. And wheatgrass in time debrides that redundant skin surrounding the ulcer, revealing its true size. So it doesn't contract, it opens up, it goes back to its normal size, then it starts to heal again. And granulation, or the filling phase, can occur at any time, as can reepithelialization. This slide shows one of the ulcers treated during the study and how rapidly wheatgrass can affect debridement. The picture on the top right demonstrates how effectively this has been achieved. That's that ulcer there. 15 years that ulcer's been there, and in 1 week we have complete debridement of that area. And if you look closer, you can see microcirculation at the base of that ulcer, capillaries, or in the bottom picture, it's clear that the ulcer floor has revitalised. It's quite an achievement, I think, considering it's been indolent for 15 years. Here's the same ulcer, and in the centre picture, after 10 weeks treatment with wheatgrass extract, the ulcer is almost filled with granulation tissue, and it's starting to grow in from the edges here. And at 4 months, we've got complete closure there. I think after 15 years, I think something's happened there. People say this is placebo. They tell me it's just good luck. It's you put alcohol in the extract or something like that, or But I think that's fairly telling, quite a fairly telling example of how it heals. This diabetic ulcer overlies the patient's right first metatarsal head. And note the small ulcer here. 4 months he's had this ulcer here, this massive thing, bulging out. But here, in 2 weeks, that ulcer's healed. And then 4 months down the track, we haven't got healing, but the wheatgrass has stopped progression, and the ulcer surface is clean, it's dry, and it's well vascularised. So it's now more likely that a skin graft can be applied to that. At least he won't have to have an amputation, which was probably quite likely the way it was. This is the same patient's left forefoot showing a hematoma bulging in the centre of the wound. And after a couple of days' application of wheatgrass spray, the hematoma has burst, and we're starting to get some encroachment here around the edges of the ulcer. And that's 4 weeks later, we've got complete healing. That actually, I've got another picture after that where it's just completely healed, it's smooth, you wouldn't know there'd been an ulcer there. This female insulin-dependent diabetic's ulcer had been present for more than 1 year. The picture on the left shows the toe 1 day after surgical debridement and application of wheatgrass extract. And after a couple of weeks, the wound is clean and there has been rapid regrowth of normal skin around the wound. At 5 weeks, the ulcer is completely healed. This 40-year-old non-insulin dependent diabetic female suffered from pain after amputation of a gangrenous hallux. She was treated with placental extract for 4 weeks, but the wound was very slow to heal and there was excessive exudate. I think placental extract is fairly expensive. After 5 weeks, wheatgrass treatment and simple dry gauze dressings, the wound has contracted significantly. The surface is dry and clean and the patient is no longer in pain. There's no evidence of infection, and at 4 months the wound is healed, clean and pain-free, and there's no evidence of osteomyelitis. Clearly there can be benefits for the patient, service provider and ultimately the taxpayer when wheatgrass extract is used to treat diabetic wounds. The wheatgrass spray is simple to apply by the patient at home. In fact, all the patients shown here treated themselves. The treatment is cheap relative to other methods, and alternate daily application is sufficient. And I believe many amputations can be prevented by this simple healing method. Remember, wheatgrass extract works catalytically, so a little goes a long way, so you don't want much. So a bottle like that will last for months. Don't waste it. Imagine how useful wheatgrass could be for reducing blood loss in the operating theatre, facilitating wound healing, and reducing recovery rates for soft tissue injuries, burns, and many other conditions. As a hands-on procedural GP, I can assure you it works wonders. Finally, this is a sample of the wheatgrass spray used in our leprosy study and for treating the diabetic foot ulcers that I've shown in this presentation. It's very safe. Allow me to demonstrate. Is it spraying? It is. Well, then you spray it the other way. I can keep it, not very tasty, but it's quite safe, perfectly safe. So, thank you very much for your time and attention.
Thank you, Dr. Chris Reynolds. We call on our patrons, Mr. R.T. Chari and Mr. Pathsathi, to present two mementos to our orator as a reminder for his Chennai visit and to make him come back again to Chennai. Thank you, gentlemen. I call on Dr. Saroja Srinivasan, Senior Diabetologist from VHS, for the vote of thanks.
Good evening, and all the dignitaries are present here. Sri D.R. Karthikeyan, Sri T.S. Krishnamurthy, Professor Suresh, Dr. Chris Reynolds, Dr. Hegde and Dr. CVK, and other donors have come here. To Mr. R.T. Chari, Professor Krishnamurthy Srinivas, Sri Sugal Chand Jain, who was here this morning, Sri Partha Sarathi, Sri E.S. Krishnamurthy, and other donors who have contributed to this VHS hospital, and Dr. Prema Krishnasamy. I first want to begin with the first session this morning. I want to thank this girl prodigy, Ayana Virama, who danced very well, and I wish her a very bright future. Especially her dance on Goddess Mahalakshmi, which we want Goddess Mahalakshmi to grace the hospital and the department. And stay there. And the lecture on energy medicine by Professor Hegde and Dr. CVK, I'm really amazed at their energy levels and their remembering so many facts and presenting the very important topic as a healer, energy as a healer. And we were very, very impressed by your lecture, sir, and we were at least 1/100th of what you teach us, we could assimilate, it will be great. To our mentor and ever inspiring Dr. CVK for his great lecture on overdiagnosis and overtreatment today's medical firmament. I want to say, sir, that we learnt a lot from your lecture on hypoglycemia and dementia. It was something new that we learned. HbA1c and the mortality rates that you discussed. Muscle injury from statins and metformin uritis, PP4 inhibitors and beta blockers increasing the mortality. It was You are our guiding star and mentor, and this lecture really imbibed values into us. And Mr. Rajan Iyer's demonstration of cases this morning about positive energy. So it's a fusion of both ancient and modern medicine, and his demonstration of cases are very unique. And I'm sure all our patients are going to be healing well under his care. Dr. Ramesh Chandrasekharan's lecture on establishing research unit for increasing the interval period in renal dialysis and cost effectiveness. And Dr. Deepa's presentation, presented by Dr. CVK, about the pulse electromagnetic field therapy, was all very well presented. The session 2 by Dr. PLT Girija on should Ayurveda be the first line of treatment in an illness, and especially her emphasis on trigeminal neuralgia, SLE, idiopathic urticaria, hemophilia, and she spoke to us about the wonders of Ayurveda. We thank her for being with us this afternoon. Mr. Venkateshan's role of EMR and hospital information technology, the high-tech talk, which we very well appreciate. About the session 3, again the dance by Aina, welcome address by Professor Suresh, who readily agreed to be proposed a welcome address despite his busy schedule. Thank you, sir, for your inspirational talk. Thank Dr. Ganeshan for introducing the president, and thank Dr. D.R. Karthikeyan for the release of the book and his address as a guest of honor. On the release of the book, Prophetic Thoughts and Articles on Health and Disease and Mind and Body by Professor B.M. Hegde, and published for public interest by TAG VHS. I think his remarks that we should charge some money for the book, which can go towards the treatment of our type 1 diabetic patients in the VHS diabetic department, may have great use. Thanks to T.S. Krishnamurthy, former Chief Election Commissioner, for release of the 3rd issue of the taglines, and also for his donation to the department. About Dr. Chris Reynolds' lecture today, we had a good interactive session with him yesterday, and we have used his spray on few patients in the department, and I'm very, very happy to say that the patients did very well after the wheatgrass spray, and we hope to use it in future with this kind contribution of the wheatgrass spray. Also wish to thank Sri R.T. Chari sir for giving us this auditorium, leave alone his contribution for the TAG VHS, Sri SSS Rajkumar, Sri Pathasarathi, and other donors of the hospital who have come here. A special thanks to Lalita Rai and Avantika for their contribution and making this event so tension-free, and to Priya for bringing out the tag links, Lalita Subramaniam, Parvati Ramachandran, Rama, Shubha, and the team of VHS TAG and VHS Diabetes Department, which have contributed a lot for this function. We also thank the press for being here from the whole day, from morning to night. And thank one and all for coming here. Thank you.
May we request you all to rise for the national anthem, and please join us for high tea after that upstairs. Thank you.
Jana Kana Mana Adinayaka Jaya